Hello, everyone. Welcome to Charting the Life Course live event focusing on the trajectory. My name is Barb Safaris, and I will be presenting with Linda Maggio. We are both Ohio ambassadors for Charting the Life Course, which means we've gone through some intensive training with the University of Missouri, Kansas City. We both work with the Nisanger Center at The Ohio State University. In addition, Linda has 15 years of personal experience advocating with a variety of stakeholder groups in 3 different states. She is currently a financial planner and a member of the Aspirations Parent Caregiver Group. I've worked in the field of developmental disabilities for over 45 years. I am a mentor trainer in the learning community for person-centered practices and also a member of the national team of Charting the Life Course. And I am also a sibling. We also want to thank Tracy Manns, who also is an Ohio ambassador for Charting the Life Course and is the Family Resource Network of Ohio coordinator. And we'll talk more about the FRNO. So Tracy has pulled this together, organizes the presentations, sets up the Zoom, facilitates the Zoom, and basically just helps us make sure that this is done and gets out to people. So thank you, Tracy.
You're most welcome.
Our Charting the Life Course presentations are funded through a grant from the Ohio Department of Developmental Disabilities, and the trainings are presented through the Ohio State University and the University Center for Excellence at the University of Cincinnati and Cincinnati Children's Hospital. And we're very happy to say that we partner with the DD Council. We always ask people to identify their roles, and typically we've broken it down in these categories. We want to make sure that we know who our audience is so we can make sure we include examples of how you can use this information in your work and integrate it as part of your work as you support and empower families. So today, we'll give you an introduction to the Charting the Life Course trajectory. We're going to focus on the trajectory, but please understand that the principles and tools in Charting the Life Course are not used in isolation from each other. They're all interrelated. So we will talk about some of the other resources that you can use as you use the trajectory that will help you gather information and empower people and families. We'll talk about how people with disabilities can use the trajectory to identify what their good life is and also what they want to avoid. And we'll talk about how the trajectory supports professionals to be person-centered to plan and empower people with disabilities and families. And we focus on being person-centered because regardless of what system you work in, or regardless if you're a family member or someone who receives supports, every service system must be person-centered, and that is federal guidance and state law. So whether you're in early childhood, school age, adult services, under the DD system, the mental health system, a medical center, school, you still have to be person-centered, and we want the families to know that their information, their perspective, it should drive the planning process, whatever that process is. And we'll also share examples of how to use the trajectory. So let's set that stage. Charting the Life Course framework is the only person-centered approach I know of that's been developed by and for people with disabilities and their families. There is a national community of practice, and it is hosted by the National Association of State Directors for Developmental Disability Services and the University of Missouri, Kansas City. What's exciting about this is that you can see on the map that Ohio is purple. That means we're part of this national community of practice. And if you know what a community of practice is, it's about a group of people who are passionate about a topic. Could be anything, could be literacy, could be math. And they commit to continuing to learn. So we never are experts. We're always learning more, continuing to learn and sharing their learning. And for us, it's exciting because we get to hear what other people are doing in the United States with Charting the Life Course, and we get to share what we're doing. And one of the things that Ohio is doing that no other state has done is we have looked at how to empower people receiving supports by integrating Charting the Life course in the peer-to-peer training called Project STIR. In Ohio, we have an Ohio community of practice, and we hope you will sign up. It just means you'll get information about resources, maybe upcoming information sessions, trainings, and also our quarterly community of practice meetings. We will share information with you, but also because it's a community of practice, we want to hear from you how you're using Charting the Life course and the impact that it's made on your work, on your own family, on the people that you support. So we're talking about the trajectory today, and the trajectory can not only be used when we're planning with people and families, but it can be used for work group work, for agency planning. And this is the vision statewide for supporting and empowering people with disabilities and their families to use Charting the Life course. So we always identify what we want and what we don't want. What we want is to see people and families using Charting the Life course to discover, plan, problem solve, and brainstorm their good life and identify supports. We want professionals to value and use that information from the person in the family to support and empower them. What we don't want people to just say, oh, Charting the Life course, these are really nice forms. They're colorful, they got icons on them. We don't want them to just be used as forms. We don't want the information to be just taken from the family and the person, but not valued and used in the planning and support process. And we don't want it to be used to reflect the perspectives of professionals and not the perspectives of the person and family. So Charting the Life course is all about a different way of thinking, having different conversations, encouraging high expectations. So we should never say, and families and people should never hear, you can't. That won't happen. We should listen to people, make sure we understand what they mean, and help them have experiences to move towards that desired good life. We also want to look at using different kinds of support and not just supports that are eligible through the systems or with public dollars, because public dollars cannot pay for everything. It is not just about the tools, it's not a program, and it is for anyone, regardless of age or ability. So in Charting the Life course, we should never hear yes, but. Yes, but I work with people who don't use words. Yes, but I work with people who are incarcerated. Yes, but I work with people who are involved in juvenile justice or adult justice. Yes, but I work with people with mental health issues. There are no yes buts. I have seen Charting the Life course used with twins under a year old, all the way up across the lifespan to people in their 90s with dementia who no longer can express the life they want using words. And that takes me to just reminding you that to be person-centered, when using Charting the Life course, we gather information from the person through their words and their actions. And in 45 years of working with people with disabilities, I have never met anyone that the people who love them and know them well cannot tell me what makes them happy, what they like, what they want, and what they don't want in their life. So we gather the information from the person through their words and actions, and from the people who know them the best, who love them, and the staff who know them well. I don't know how many of you have heard of Chris Nikic, and I apologize if I am saying his name incorrectly. But Chris is from Florida. Chris is the first person with Down syndrome to not only enter the Ironman competition, but to complete it. And what I love about his story and the stories that you can find online about him is that he shares that his parents made him write his dreams down. And so on the left-hand side on the whiteboard, you see that he wrote he wants to buy his own car, he wants to buy his own house, he wants to get he wants a smoking hot blonde wife from Minnesota. And I don't know how he has focused in on Minnesota and a smoking hot blonde. He wants to have his own money so he can take care of his family, and he wants to become a famous public speaker. Look at his dreams. They are probably dreams that we all have had. To have money, to have our own car, a house. I'm not going to ask how many people want a smoking hot blonde wife from Minnesota, but the power, the reason I love this is because we know that when people write down their dreams, their vision of a good life, they are more likely to work towards it and to achieve it. So his parents have told him, write it down. Also, we need to remember that they should be written down in a way that the person understands it and then can look back on it. If you look at other stories about Chris, you will see that he also has written on a whiteboard his goal of participating in the Ironman, and he kept track of everything he had to do to get to that outcome. Again, writing it down and being able to track his progress. The core concept of charting the life course is that all people and their families have the right to live, love, work, play, learn, and pursue their life aspirations in their community. I want you to recognize that it doesn't say people with disabilities, it says all people. This is something that all of us have the right to do. And if you are in the field, you might recognize this language. It comes out of the Rehab Act of 1975. So it is not a new concept. It is over 45 years old. I hope my math is right. We also want to see that people have good life outcomes. So for the person, we want to make sure they have the civil right of self-determination. And self-determination is not just about making choices. Self-determination is having the right to have control over decisions that affect your life. And that is in federal law. We want people to be interdependent because no one is independent. Any of you that are employed, there's a reason why you're working, and that is because you need the money to have the life you want, so that you can buy the things that you can't do yourself, a house, a car, your clothing, your food. So we are all interdependent. And then of course, we want everyone to just feel part of their community. For families, we want them to be supported so that their strengths, their resilience, are recognized and supported to grow so that they can nurture, love, and support the people that they love in their family and help them have the good life. In person-centered thinking, our core concept is we want people to have better lives, not just better paper. So what's a good life? You know, we use a lot of cliches in our field. Oh, it's a good life. What does that mean? Well, a good life is that you have dreams, because without dreams, we don't have a life, and all we get is what we're given. And everyone has dreams. We have people who believe in us. So think about when you express something, did anyone ever say to you, well, that'll never happen? I know for me, it was like, why, you're a girl, why do you want to go to college? Have what's important to you. And I'm not talking about likes and preferences, but what's important to you. To be respected as a contributing member of your community, whatever your community is, whether it's geographic, cultural, spiritual, virtual, whatever you define as your community. It's not an address. That you have more good days than bad, that you feel healthy and safe in your own way. So during this pandemic, we probably all have different definitions of what healthy and safe means to us, and that we feel in control. So important too, you all know, you've seen this heading on plans. It's been mandated in Ohio for over 15 years. It is in federal guidance that we have to include what's important to people. But what's important to people are not just likes and preferences. It's those things in our lives that give us comfort and fulfillment and help us be happy. And it's not the third bullet, things to do and places to go. I can ask people all over the country what's written on the ISP for important to, and they'll give me the Holy Trinity: going shopping at Walmart, going out to eat at McDonald's, going bowling. And those three just tell me that's what people do. But I don't know if it's important to people. And those all fall under things to do and places to go. We need to look at the other 7 areas. So who are the people that are important to them, and what are the relationships? And I'm not talking about just listing family and friends, because you all don't like everyone in your family equally, and they are not equally important to you. What gives us status and control? I am guessing that your house, where you live, having a car, your technology. A lot of people with disabilities, status and control is having technology, having a key to the house, being able to get in their house by themselves without someone having to let them in. Rituals or routines. Every one of us has rituals and routines. We all get up in the morning and do something, you know, to get ready. We have the same with getting ready to go to sleep. Think about your meal routines. Do you sit in the same place? Do you have certain meals on certain days? What are your celebrations like? Do you eat certain food? We all have rituals and routines. Rhythm and pace of life. You know, are people morning people? Are they get up and go? Do they move slowly through their day? Things to have. I always laugh because people say, there's nothing important to me, and I can look around a room and I see very expensive mugs, water bottles, technology. So it is important. It is important to us to have certain things. And I always wear a wristwatch, not a smartwatch, a wristwatch. And I'm in my house and I still put a wristwatch on, even though my smartphone is next to me and a wall clock is 10 feet ahead of me. And then what gives us purpose and meaning in our life? How do we feel valued? And it's because we contribute. And then the last area of important too is culture and identity. And I'm not just talking racial identity. I am talking about culture and identity on multiple levels. How do people identify themselves? What groups do they identify with? Important 4 is, well, we all probably have PhDs in this, health and safety. But the third leg of that is what's needed so that people are seen as valued contributing members in their community. So how are we helping people be seen as valued contributing members of their community? I'll call it a simple trajectory. It's a trajectory for exploring. So you can use this to help people think about what is a good life for you? What do you want to avoid? And that's all it has, 2 areas. But it's used to help people think. So it might be the first step that you start a conversation with somebody that you're working with or love, and you just start writing down, what is your vision of a good life? What don't you want? I will tell you that most people with disabilities, what they want is to have a boyfriend or a girlfriend. And I figure they're geniuses, because that's the #1 human need, is to be loved. What they want is to have their own place, to have a key, to have a job they like, to have a career. And the #1 answer for what they don't want is drama. And I always have to ask people, because I don't know what it means. What does drama mean? For families, what they want is they want their family member to have friends, to be valued, to be loved by someone other than their parents or their siblings. And what they don't want is for them to be taken advantage of, physically, emotionally, sexually, financially. You notice that I did not list services. If people tell us, they list a service, we need to facilitate that conversation to really get to what does a good life look like for them. So here's Ben, here's his good life vision. This was developed by Ben's parents and Ben together. But we would ask that, parents do one separate from their loved one or their family member. But you see general categories, and you see a photo, which I love when we include photos, that he wants tattoos, and his mother will tell us that he already knows the next tattoo he wants when the pandemic is over. But look at what he wants to avoid: segregation, poverty, poor health. If you see the arrows, the solid black arrow goes up towards what he wants, what a good life is. The blue arrow, we know that life is not all, straight up to the life we want, that sometimes there are detours. And we all understand that because of the pandemic. So when someone's life starts going towards what they don't want, we need to start helping them get back on track to what they do want. We're not going to do a breakout room, but what I want you to do is take a minute and write down, what is a good life for you? Write it down on your handout on a piece of paper, but there's power in writing it down. And also, you should never do this with someone if you have not done this on yourself. So we are not your guinea pigs as families or people with disabilities. So what is your good life? And be specific. If it's family, what about family? Is it having dinner so many times a week? Is it getting together on certain days? For friends, what does that look like? Is it Zooming now with friends, or having a book club online, or whatever? And financial stability. Also take time to identify what you don't want and what you want to avoid. So for my simple trajectory, a good life for me is that I stay healthy so that I can provide the daily caregiving that one of my family members needs, and caregiving, not so daily caregiving for other family members, that I can share my passion about supporting people in disabilities from my perspective as a lifelong physical caregiver, and also as a professional, that I can financially support myself and also have money to do fun things like travel and shop. And what do I want to avoid? I want to avoid, obviously, getting sick, but I also want to avoid having to work full time and having to have a boss. So think about what your good life is like, what you avoid. Now, how many of you wrote that you want to live in the community or get a job in the community or be more independent. Those are typical service goals that we have taught people and families to articulate during the planning process. And if they say that, then we need to refine our conversation and ask them, what does that look like? How will you know? Because none of us calls up our friends and says, boy, I reached my goal of living in the community, or I have a job in the community, as opposed to where. This is an expanded trajectory. So again, you see the arrows on the right, the vision of a good life, the vision of what you want to avoid. But we also respect and know the value of past experiences. So on the left, we talk about past life experiences that have impacted us to go either towards what we want or not, and what we need to do in the future. Let me show you an example. So we talked about Ben. Let's just look at a couple things. He wants to go on vacations. And if we look at his past life experiences, we see that he went on family vacations. So he knows what a vacation is. He's had experience. We also know that he wants to volunteer at the fire station. So he's had some volunteering opportunities in the past, but a future step is to get him an opportunity to volunteer at the fire station. Not only at the fire station, but find more opportunities for volunteering. Things that he wants to avoid: segregation. We see in the past what past experience he had that took him toward that life he didn't want was going through special ed where there were low expectations, and also having a paraprofessional glued to his side. His mother shares that when he started volunteering at the fire station, he had a staff member go with him. And after a couple of days, the chief called her and said, who is this woman that comes with him? And why is she here? And his mom, Ben's mom, shared that that was his staff and that was her job to help him do things in the community. And he said, she gets in the way and people can't talk to Ben. They don't feel comfortable like hanging out with Ben because this woman is always standing there. And she said, yes, but part of her job is he has seizures. And so if he has a seizure, she knows what to do. And he said, we're all EMTs. If he has a seizure, we'll know what to do. And she just went, oh my gosh, this woman being there keeps him from hanging out with the guys and just being one of the guys at the fire station. And think about it, think about our high schoolers. If they always have a staff with them, how comfortable do you think those other teens are going to be coming up to them and chatting with them? So we all know that our lives took a severe, different change last March. It's almost been a year. And we know that in order to have a good life, we need to have those 8 things, 8 areas of what's important to us present in our life. So think about what you are missing the most in this pandemic. And you can choose several. We're not going to do a poll, but think about it. What are you really missing? And I am sure it is no surprise to you that what people miss are being with others, people to be with in relationships, things to do and places to go, and also rituals and routines. And when people say that, they mean they miss getting up, you know, getting dressed, going to work, having that time in the car to do whatever you do to transition to work, seeing your coworkers, having those moments, you know, that you can interact with people. So let's look at our life during the pandemic. I want you to, as we go through this, I want you to think about your own trajectory during this past year and how it has changed. And please jot things down. Like I said before, it is we truly believe that you should not use a resource or tool with someone or a family unless you have actually used it on yourself. So let's think about a vision for a good life during the trajectory. Uh, is your vision, were you thinking, oh my God, am I going to have a job? Am I going to be able to support my family and myself? Were you concerned about being healthy? Is that your vision? I want to stay healthy. Did you start defining what you would and would not do? Did you, now that you've been working remotely for several months, are you thinking, well, I want to continue to work at home? I like this. And what did you do to make sure that important to you was present? Did you learn how to use Zoom? Did you teach some family members how to use Zoom? Did you have to teach family members how to position the camera so you weren't looking at their forehead or the ceiling? And then what is it that you want to avoid? For me, I don't want to get COVID, but I also don't want to expose others. So I take actions that are driven by those two visions. Then let's look on the far left of that expanded trajectory. What past experiences have led you or who have helped you move towards the good life? Have you worked at home before? So you knew that, okay, I've got to set up a routine. I got to have a place to work. Had you used Zoom before or other platforms? Did you have masks? I just remember how hard it was to find any masks initially. And I was so grateful that a friend of mine sews and called me one day and says, there's a we're dropping off a package at your door, and it was masks. And I was like, oh my gosh. I remember talking to my niece and nephew and who had to go to work and said, do you have masks? And he said, I have N95 masks. And I was like, how did you get N95 masks? And he goes, I've been renovating the bathroom, so I bought them to, tear the plaster down. So did you have masks? Did you have technology at home? I was doing training nationally, and there were people who were like, I don't have a printer, I can't print this out, I don't have a webcam. And then what past experiences maybe could lead you towards what you don't want? Did you have a pre-existing condition? Were there risk factors? Are you a caregiver of someone? Do you live with someone who's high risk? Or have you worked at home before and didn't like it? And then in the middle, what can you do next? Did you have to learn how to use Zoom? Or what's the other ones? There's all different platforms and they're all different. Did you have to learn how to use mute? And I can tell you from personal experience, we're all still learning how to use mute. Did you have to develop new routines and rituals? I don't stand up when I do presentations because I am dressed and appropriate from my waist up. So do you have a new routine and ritual? Did you have to teach others? Did you have to learn how to balance? Are you dealing with virtual school and pets? And did you have to find new ways to have what's important to you? And then future life experiences of what you don't want. Some people have said, I don't want to work at home after this is over. I miss people. Or I don't want to be isolated and feel isolated. For those of you who do planning, you will recognize that if you help a family or a person really use the trajectory to capture their thoughts of what they want, their past experiences, and what maybe they need to do in the future, you have outcomes, you have history, and you also have action steps, which helps you then develop the plan of how do we identify services and supports to help people have the life they want and avoid the life they don't want. So right now I'm going to turn this over to Linda.
Thank you, Barb. So as Barb said, the trajectory can be used for many situations, including in your own personal life. Here, I used it for retirement planning. My vision for a happy retirement includes owning a condo or small house, living near an urban area, carrying minimal debt, and benefiting from years of contributing to my IRA. To get here, I had to look at my past life experiences, which included owning a home in New Hampshire on 2 acres and a condo in a suburb of Boston. And for me, I enjoyed the condo close to a big city much more. Other experiences were carrying too much credit card debt and sharing apartments with roommates. Then I took the experiences and divided them between things I want to carry forward and things I want to avoid. As I completed this trajectory, I had several revisions to it, and I did it over a couple of days. So you can see it can be used for personal goals as well. As I was going through my finances, I realized that the stable account I'd set up for my son was a big benefit. If you're not familiar with Ohio's stable account, it allows you to put money aside up to $15,000 per year and use it on expenses related to your disability. And not just medical expenses, but living, housing, transportation, education, employment training, and more. And the best part is the account allows you to keep your public benefits. So it will not count against you in terms of determining eligibility for SSI or Medicaid and will not affect your eligibility for state-based programs. I mention this because as a parent, I had to think about how to help my son financially, so I set up a stable account and I've found it to be a great benefit to our family. On the next slide, um, further about the trajectory, it facilitates conversations about personal outcomes. It is not a team tool or done in a meeting. It belongs to a person or the family, and it should be done by them. Others can provide input on a trajectory from their perspective. It helps the team focus on common outcome. Does this person have the life he or she values? And it keeps the team on track. On the next slide, early intervention staff want to use this during EI to support families and promote their vision during transition. It does need to be reviewed when there's a life change, and it can be broad, a whole life, or specific to a small or short span. On the next slide, we have a great example of creating a trajectory in a variety of ways. This picture is a group of participants with disabilities using a vision board to create their trajectory. Some wrote it out, some drew it out, and cut out pictures from magazines. The next slide shows this trajectory was done by participants at a Project STIR training. Everyone was asked to write on a sticky note what would make a good life and what they want to avoid. Some of the common themes were have their own home and to have a girlfriend or boyfriend. These are not goals specific to people with disabilities. These are universal goals that we all have and share. One of the participants wrote that they did not want to die alone, and people quickly jumped to quick fixes and said, "Oh, we'll help you find friends." And while everyone had the best intentions, what is important to remember is that when we hear these statements, the first question to ask is, what does that mean to you? It is best to clarify the person's needs before we start coming up with solutions. Additionally, this type of conversation should be done in private and with a trusted person. Another piece of the framework are the 6 life domains. When they look closely at individuals and families who had successfully integrated services to create their good life, they did not just do this in one area. All of us develop our lives across different areas. Everyone, whether they have a disability or not, has to figure out what they're going to do during the day: school, work, volunteer, where they're going to live, and how they're going to stay safe and healthy. Using the Charting the Life course tools helps you evaluate any of these domains at any age and identify next steps or experiences that will lead you on your trajectory to a good life. The next tool, the vision tool, helps us gather information from multiple perspectives. We often think that we all have to agree on everything. This is not consensus. Consensus is agreeing to move forward. Sometimes there are differences between the person and families. This respects those differences and gives us a way to gather information from both. We can then identify common areas, overlapping visions, and identify how to move forward. Again, here are the 4 points reiterating why it is important to get each perspective and to honor them. The next slide, this is a resource that helps us all reflect on what to consider now, our current life stage, what we should have considered in the past life stage, and what to anticipate in the next life stage. For service coordinators, it provides suggestions for conversations. For people with disabilities and families, it provides things to consider to support them to identify and work towards a good life. It is organized by life domain across life stages. On this slide, this is a page from the daily life and employment domain, which is part of the booklet. It asks questions from the perspective of the disabled person. Some of the questions it asks parents to consider during the school age phase is, how am I included at school with typical peers? Am I learning social skills as well as daily living and academic skills in my school experience? Do you ask me what I want to be when I grow up? Am I learning about lots of different jobs for my family, teachers, and others? That could be your OT, your speech pathologist, other people that are part of your life. Often, as parents, we get funneled through the system, and sometimes the school district wants your child's services to fit into a nice square box that they offer. However, sometimes the child's needs don't fit in those nice square boxes, and this guide will help parents keep their child's needs at the forefront and encourage them to advocate and look at that good life for them. In this booklet is a 2-page spread for every domain across the lifespan. On the next slide, what these are just pictures of each domain as an individual 4-page guide. So these guides will give you all the questions again for each domain. The SSAs should have a copy, and one should be given to the family to help them start thinking about the next transition. And these are also available on the website for free, lifecoursetools.com. Because what we have come to know is that life experiences lead to life outcomes. And when we identify and create experiences that are desired and will keep us on the trajectory, we are more likely to reach our desired good life. For example, with my son, when he was young, he was often left out at school, particularly during recess. I had him join a variety of sports teams: t-ball, tennis, basketball, swim, wrestling, hockey. Some of the sports did not make sense to him, and he'd get frustrated. But I helped him understand the nuts and bolts of the sport so that he could play the game, and he actually excelled at many of them. He had no desire to continue to play them, but as a result of him knowing how to play the sports, he was able to participate with his peers during recess. And so, in effect, it opened up doors for him. On the next slide, we're going to talk about various life possibilities for people with disabilities and their families. And there are 3 categories. You have your innovative ideas, which are very new or undiscovered. You have your islands of excellence, which exist in a lot of places, but not everywhere. And then you have your traditional options, services that have existed for a long time. We're going to look at where I live. So for your traditional options, it could be training centers, group homes, intermediate care. Islands of excellence could be a shared living space, independent supported living, and innovative would be not yet discovered. And we should separate where someone lives from the services. We want to help them think outside the box and come up with solutions that give the control to the person with the disability. On the next slide, we talk about how am I supported. Again, traditional option would be staff hired by provider. Islands of excellence could be remote monitoring, assistive technology, or human service co-ops. And innovative would be a new possibility. So again, we can rethink options of how we support people with disabilities. The next page is what do I do during the day? And your traditional would be your sheltered workshops or day habilitation. Islands of excellence could be college or technical schools, junior colleges, 2-year programs, supported employment, and then there are also certificate programs, which can be very helpful in getting you into a job or career. And then your innovative is a new possibility. So here is the resource that I talked about earlier to think about options and to give to families. This tool is to help individuals and families look at a variety of life options in each of the life domains, some of which are traditional and no longer preferred, some that are known and tried, but not necessarily the norm, and others that are new or unfamiliar to individuals, families, and professionals. And back to you, Barb.
Thanks, Linda. So another way we can use the trajectory is to show you what we want to see as far as people and families using the trajectory, and also what we don't want. So what we want to see is that the person and family gather their thoughts about what a good life is, what they don't want. That staff, professionals can start the conversation, during, not in a meeting, but having a conversation with them and start writing on the trajectory, what the person in the family says. They may have to facilitate the conversation and dig into what does this really mean if people give us service goals. And then they can even have a trajectory. I worked with a young man and his parents, and mom did a trajectory, dad did a trajectory, and the young man in his 20s did a trajectory. And then I coached them to compare their 3 trajectories. So you can have multiple trajectories from different perspectives. And remember that the trajectory belongs to the person. So if you are a professional and you started writing on the trajectory, you should give them the paper and say, this is what I heard you say. Please take it, think about it, and add to it, and then share it with us so that we can figure out how to best support you. And as Linda said, she did her trajectory for retirement over time. It wasn't a sit down once and do it. And it also, what we don't want to see is that it's done in a team meeting. So it should never be pulled out in any planning meeting, IFSP, IEP, ISP, whatever P you have in your life. It's not to be done at a team meeting, and it's not to be done by a team. It's not what we think is a good life, but it's what does the person say? What does the family say? So for those of you that provide services for families, I often, as a family member, I had a different definition of what quality was from what the system would say. And what I want you to consider is that quality should be that services and supports help the person have the good life they want. Quality means that services and supports are not taking people down to the life they don't want. And quality is when something happens in a person's life and their trajectory moves towards what they want to avoid. And think about the pandemic. Think about if someone has an accident, falls, breaks bones, and they have to go to rehab to a segregated setting. What are we doing to help them get back to their home? And then our services and supports helping the person have a balance of what's important to them in those 8 areas and important for, which is health and safety, but also a valued role in the community. Whenever we use a person-centered thinking skill or charting the life course tool, we should always know in our own minds, why do I think this will help? Why am I pulling out a trajectory? Why do I think it will be helpful as I'm having a conversation with this person or this family? Then we need to explain that to the person. This is called a trajectory. It might help you think about the kind of life you want. Here's a vision tool. It talks about 6 domains of life that we all talk about: where we live, what we do, who we hang out with, how we feel healthy and safe, how we speak, how we participate in our community and speak up for ourselves. Those are all areas we all talk about in our life. Giving them that vision tool, this might help you think about what you might want. Giving them that support options, innovative options, the chart, it's not only these things that are available, but here are some different options to think about. We also know that now that we've given you some in-depth information about the trajectory, you don't need to use this with everybody. There are some people who have told you what they want, and they are very clear. And so you don't need to use this with everybody. And also, again, please use it on yourselves before you use it with someone else. And then the paper, that piece of paper, we give families lots of paper. And what families have said to us is, this paper makes sense. It's logical. I know what it means. You've given me information. I can use this paper. If you start using the paper and writing on the trajectory, please remember that the paper belongs to the person and the family. If you need it for your work, keep a copy, take a photo on your smartphone, do whatever. But the paper belongs to the person. And people with disabilities and families have told us the paper gives them power and the paper gives them courage. I don't have to sit there when people ask me, what do you want? I've got it written on paper. So I don't have to feel like a deer in the headlights. I've already thought it through. I have it organized and I can give it to people. So today we talked about 4 of the 8 guiding principles in charting the life course. We talked about how a trajectory is valuable for all people, regardless of ability or life stage. We talked about the 6 domains. They're the way that we talk about our lives. They're the way we talk about our quality of life. We have a good life because we live wherever we live, whatever, we're doing things during the day that we love. We have friends, that we feel healthy and safe, and that we are valued as a member of our community. And that we talked about the life stages and the trajectory, that we can look at the life stages from prenatal and infancy all the way up to aging. Maybe the trajectory changes across the life stages. Maybe it stays the same if it's a big picture value based. And you can do it for each life stage. You can do it for a short amount of time, or you can do a big picture. And the importance of having life outcomes, of recording them in a way you understand them and can refer back to them. And use them to keep the people who support you, both paid and unpaid, on track. So some highlights from our Family Resource Network of Ohio.org. We have another Charting the Life Course event coming up on April 8th. From 9 to 10, and that will be about domains. And we'll spend an hour sharing information about the domains and experiences and opportunities. And please sign up on the frnohio.org page so that you can get information on how to register for that event. We also are scheduling a showcase. It will be virtual for Charting the Life course. The date right now is June 3rd, and our keynote speaker will be Dr. Shelley Reynolds from the University of Missouri, Kansas City, under whose leadership the Charting the Life course framework and principles and tools were developed. Not only sign up for our webpage, on our webpage, and when you go to the webpage, a pop-up will come up that says, do you want to sign up? Please sign up, but also like our Facebook page, Family Resource Network of Ohio. We really want that to be a place where we share information, but also you share information. So if you've used Charting the Life course, one of the tools or principles to impact your work, impact your own life, please post and share on the Facebook page. It always helps if you hold up the resource, but we don't have to be able to read it. There's so much power when people hold up something and say, this is mine, and I wrote on this. And like I said, we don't have to be able to read it, but just the power of that you use the paper and the impact of having it on paper. And if you're part of any groups that you think could benefit from hearing about Charting the Life course, you can make that request on the frnohio.org page. And we'd be happy to see what we can do to support you, as you support and empower people and families, including we will share with any group of stakeholders that help people, family groups of people with lived experience. Linda talked about lifecoursetools.com, and you can find all the resources that we've shared with you on that web page. They are free. All you have to do is download them and save them. We're not going to do breakout rooms, but what I want you to think about is, how will you use the trajectory? And I don't mean I'm going to use it in my work. I want you to think about, in the next 2 weeks, how can I use a trajectory? Are you working with somebody who hasn't been able to tell you anything beyond services? And so maybe you can use the trajectory and the vision tool to help them think more broadly. Are you going to do it for yourself because of something that's happening in your life? Are you going to use it with a family member? So be specific, think about it. The reason I say that is, when we typically attend any kind of training or information sessions, if we don't immediately identify an application, we probably will say, yeah, that was a great session, and you'll have a folder and put the stuff in the folder. So think about what you're actually going to do. And then also, what did you appreciate about this, this session? And I know that there's no breakout rooms, no chat box, but I believe you will get a feedback form, and we would appreciate any feedback you have. So again, thank you very much. We appreciate your attention, and we look forward to hearing your stories, your feedback about this presentation, but also your stories of how you are using Charting the Life course in your own life, with people you support, with family members. So thank you very much.